Good day. My name is Dr. Gabrielle Swan. I'll be presenting on my grant proposal for the EMS Substance Use and Abuse and Mental Health Training Program. According to the 2021 Community Health Needs Assessment by the Riverbend Hospital and North Central Health Services, they found a high percentage of Indiana adults reported receiving treatment or counseling for many health illnesses. However, a lower percentage reported improved functioning due to treatment received compared to the national average. For Clinton County specifically, 16% of the population reported frequent mental distress, which was higher than that of the state's percentage at 15%. Also, the county's ratio of mental health care providers to patients is 2,310 to 1 compared to the state at 1,012 to 1, which can also be attributed to the low percentage improved functioning by the patients who have received treatment. The community needs for increased availability of mental health care providers is an important issue because it is an indicator of access to health care, and also improving the access to adequately trained mental health care providers can potentially reduce poor health outcomes for those patients. As emergency medical services are usually the first responders on an emergency cases, as well as providers for urgent pre-hospital treatment and stabilization, it is imperative that they are equipped with the tools and skills they need to adequately respond to the substance use and abuse as well as mental health cases. The EMS Substance Use and Abuse and Mental Health Training Program intends to train all EMS personnel in Clinton County, Indiana, with the tools and skills they need to provide adequate care for patients, specifically those with substance use and abuse and mental health illness. The program's training will be provided via the SAMHSA's Addiction Technology Transfer Center. In the program, there will be various activities to ensure that the EMS personnel are adequately equipped to manage patients. Some of the activities include the EMS personnel being trained to use the FDA-approved opioid reversal medications in emergency overdose situations, learning procedures to connect those undergone overdose reversal to substance disorder treatment, learning to use motivational interviewing to engage individuals while also providing referrals to treatment, and developing procedures to ensure all overdoses are reported to the state and local public health departments. The EMS personnel will be recruited from the local hospitals. The training program will approximately be 4 months, with a new cohort 1 month after the previous group's completion of the program. The staff of the program will include 1 project manager, 2 assisting staff, 2 mental health consultants, and 2 mental health nurses. For this program, we will be connecting with our community partner, which will be the Purdue Extension Organization in the Clinton County, Indiana region. The county's branch of Purdue Extension. Purdue Extension is considered a nonprofit organization that was founded in 1914 to enable the dissemination of the research for each experiment station to local residents. The mission of the organization is to deliver practical research-based information that enhances the lives and the livelihoods of those within the region. The organization provides services to over 680,000 residents in Indiana and 92 counties. Some of the key programs under the Health and Human Sciences, which is one of the sectors within the Purdue Extension Organization, includes the Mental Health Program, Financial Resources for Higher Education, and Health and Nutrition. The expected outcomes for this project is for after completion of the program, there will be a 30% increase in filed patient reports of substance use, abuse, and mental ill patients. In addition, 60% of the trainees will report changes in their assessment and management of substance use and abuse and mentally ill patients. The overall expected impact of this program is to increase access to quality care for substance use and abuse and mentally ill patients. As for the timeline, we expect that after receiving funding, we expect to start in August to December 2024. with the first phase being the formulation phase. The project director, which will include the project director recruitment, who will then identify partner agencies. Also, recruitment of other project staff, which will include the previously mentioned uh, assisting staff as well as mental health consultant and nurses. They will also all join together to formulate the program, including finding a location, training staff, and obtaining project materials. The second phase is the implementation phase, which would essentially be during the January to May 2025. During this period, we will recruit the EMS trainees as well as implement the program, which would last approximately 4-month period starting in February to May. The final phase, which would be considered the evaluation phase, which will also be ongoing through the program, which will occur in the month of February, March, and May 2025. During this period, the first evaluation will occur during which will be the pre-test distribution as well as analysis occurring in February 2025 before the commencement of the program. Secondly, the midpoint feedback survey occurring in March 2025, as well as the post-test distribution and analysis occurring in May 2025 at the end of the program. The program will be evaluated through the proposed process of evaluation, which include a process evaluation and outcome evaluation. The functioning process to the program will be evaluated at the midpoint of the program via survey distribution to the trainees to assess factors such as satisfaction with the program and if there is any factors that can be done more efficiently. Lastly, the outcome will be evaluated via pre- and post-test surveys that will assess trainees' knowledge, attitude, and practices as it relates to their response to substance use, abuse, and mentally ill patients to identify the program made any changes in their response. For this program to successfully begin, we would need to require funding, and our budget, with our budget, we are requesting $200,000. The funding will go towards the annual salaries for non-volunteering personnel and other remaining expenditures, which would include the salaries for the project director who's working full-time, the 2 assisting staff part-time members, as well as the consultants in mental health, as well as the 2 nurses. Also, employee benefits, which equates to approximately 20%, as well as non-personnel related expenditures such as printing, which we are equating to $2,000, for a total of $181,400. Finally, I would like to acknowledge and say thank you to Purdue Extension Clinton County for assisting with this program. My references has also been included in this poster presentation. Thank you.